The battlefield is a crucible, testing the limits of human endurance. Soldiers face unimaginable horrors, the scars of which often run deeper than any physical wound. In the aftermath of combat, many grapple with invisible wounds, the debilitating effects of post-traumatic stress disorder, depression, and anxiety. These hidden injuries can lead to a dangerous dependence on drugs or alcohol, a struggle that has plagued armies for centuries. It is crucial to recognize addiction not as a moral failing but as a disease, a complex medical condition requiring comprehensive treatment and support. The Army, to its credit, has made strides in recent years, acknowledging addiction as a disease and implementing resources for support and recovery. The Army's shift towards recognizing addiction as a disease marks a significant step forward in addressing this critical issue. By acknowledging the medical and psychological underpinnings of addiction, the Army can better provide soldiers with the necessary tools and resources to overcome this challenge. This includes access to evidence-based treatment programs, counseling services, and peer support networks. The Army has also implemented initiatives to raise awareness about addiction, promoting education and prevention strategies to mitigate the risks associated with substance abuse. However, there is still much work to be done. The stigma surrounding addiction persists, preventing many soldiers from seeking the help they need. Fear of career repercussions, social isolation, and a culture of silence can create significant barriers to recovery. It is imperative that the Army continues to foster an environment of understanding and support, encouraging soldiers to come forward without fear of judgment or reprisal. By breaking down these barriers, we can create a pathway for healing and empower soldiers to reclaim their lives from the grip of addiction. The fight against addiction is not one that can be won alone. It requires a collective effort, a commitment from both the institution and the individual to confront this challenge head-on. By providing comprehensive support, fostering a culture of empathy, and empowering soldiers to seek help, the Army can help its own win the battle against addiction and pave the way for a healthier, stronger force. The road to recovery may be long and arduous, but with the right support, hope, and unwavering determination, victory is within reach. The connection between mental health and addiction is undeniable. Soldiers who have experienced the trauma of war often carry with them invisible wounds, the psychological scars of combat. PTSD, depression, and anxiety are common among veterans, and these conditions significantly increase the risk of developing substance use disorders. The numbing effects of drugs or alcohol can provide temporary relief from the overwhelming emotional pain, but ultimately they exacerbate the underlying issues and lead to a vicious cycle of dependence. Studies have shown that soldiers with PTSD are significantly more likely to engage in substance abuse than those who have not experienced combat-related trauma. The intense flashbacks, nightmares, and hypervigilance associated with PTSD can make it extremely difficult to cope with daily life. In an attempt to escape these debilitating symptoms, many individuals turn to drugs or alcohol as a way to self-medicate. However, this coping mechanism is ultimately counterproductive, as substance abuse only serves to worsen the symptoms of PTSD in the long run. The high prevalence of mental health issues among veterans highlights the urgent need for comprehensive support services. Early intervention and treatment are crucial in addressing these invisible wounds and preventing them from escalating into full-blown addictions. This includes providing access to mental health professionals, trauma-informed therapy, and peer support groups. By addressing the root causes of addiction, we can break the cycle of dependence and help soldiers heal from the inside out. It is also important to address the stigma surrounding mental health within the military. Seeking help for mental health concerns should be seen as a sign of strength, not weakness. By promoting a culture of openness and support, we can encourage soldiers to come forward and get the help they need without fear of judgment or repercussions. The invisible wounds of war may not be visible to the naked eye, but they are just as real and debilitating as any physical injury. It is our duty to provide our veterans with the care and support they deserve so that they can overcome these challenges and live full and meaningful lives. Amidst the darkness of addiction, there are always stories of hope, of individuals who have fought their demons and emerged victorious. These stories serve as a beacon of light, reminding us that recovery is possible, even for those who have fallen to the deepest depths of despair. One such story is that of Sergeant Daniel Carter, a decorated veteran who served multiple tours in Afghanistan. Haunted by the horrors he witnessed, Sergeant Carter returned home a changed man struggling with severe PTSD and a growing dependence on alcohol. Sergeant Carter's descent into alcoholism was a slow and insidious process. What began as a way to numb the pain of his memories soon spiraled into a full-blown addiction that threatened to destroy his life. He became withdrawn and isolated, pushing away his loved ones and losing himself in a haze of alcohol-induced oblivion. However, even in his darkest hour, a flicker of hope remained. With the support of his family, friends and fellow veterans, Sergeant Carter decided to seek help. He checked himself into a rehabilitation facility where he underwent intensive therapy and began the long and arduous journey of recovery. It was not an easy road. There were setbacks and relapses, moments of doubt and despair, but Sergeant Carter refused to give up. He drew strength from his fellow veterans who understood his pain and supported him every step of the way. Through sheer determination and unwavering support, he broke free from the chains of addiction and reclaimed his life. Today, Sergeant Carter is living proof that recovery is possible. He's a dedicated husband and father, a successful businessman, and an active advocate for veterans' mental health. His story is a testament to the resilience of the human spirit and the transformative power of hope. It reminds us that even in the face of unimaginable adversity, there is always light at the end of the tunnel. By sharing his story, Sergeant Carter inspires others to seek help and shows the world that recovery is not just a possibility, but a reality for countless individuals who have the courage to fight for it. While some nations focus on providing support and resources to those battling addiction, others have adopted a more controversial approach. Sri Lanka, for example, has implemented a militarized strategy to combat drug use, one that has drawn criticism from human rights organizations worldwide. Under this system, individuals suspected of drug offenses are often arrested and detained in military-run rehabilitation centers, where they are subjected to strict discipline, forced labor, and limited access to due process. Proponents of Sri Lanka's approach argue that it is necessary to address the country's drug problem, which they claim poses a significant threat to national security. They point to the perceived success of similar programs in other countries, such as the Philippines, where extrajudicial killings of suspected drug dealers and users have been rampant. However, critics argue that this militarized approach is not only ineffective but also deeply unethical, violating the fundamental human rights of its citizens. One of the primary criticisms leveled against Sri Lanka's drug rehabilitation centers is the lack of transparency and accountability. The facilities operate largely outside the purview of civilian oversight, making it difficult to monitor conditions and ensure that detainees are being treated humanely. Reports of abuse, torture, and even deaths within these centers have surfaced, raising serious concerns about the methods being employed. Moreover, critics argue that the focus on punishment and forced detention does little to address the root causes of addiction. Without access to adequate healthcare, counseling, and social support, many individuals released from these centers are likely to relapse, perpetuating a vicious cycle of incarceration and addiction. The militarization of drug rehabilitation raises serious ethical questions about the role of the state in addressing what is fundamentally a public health issue. Instead of resorting to punitive measures, governments should prioritize evidence-based approaches that emphasize treatment, rehabilitation, and social reintegration. Section 5. The shadow of imprisonment, ethical concerns and human rights. The use of imprisonment as a primary response to drug addiction raises a host of ethical concerns. Firstly, it frames addiction as a criminal issue rather than a public health crisis, perpetuating stigma and deterring individuals from seeking help. The fear of arrest and incarceration creates a significant barrier to treatment, driving the problem further underground. Instead of receiving the medical and psychological support they need, individuals struggling with addiction are often met with punishment and isolation, exacerbating their condition and hindering their chances of recovery. Furthermore, the conditions within many prisons are often detrimental to the well-being of individuals with substance use disorders. Overcrowding, violence, and limited access to healthcare create an environment where addiction can thrive. The lack of adequate mental health services within the prison system further compounds the problem, leaving individuals vulnerable to relapse and exacerbating existing mental health conditions. The use of forced labor in some drug rehabilitation centers also raises serious ethical questions. While proponents argue that it provides structure and a sense of purpose, critics denounce it as exploitative and counterproductive to genuine rehabilitation. Forced labor can be physically and psychologically damaging, particularly for individuals already struggling with addiction and other health issues. Instead of promoting healing and reintegration, it can perpetuate a cycle of trauma and abuse. The criminalization of drug use disproportionately impacts marginalized communities, exacerbating existing inequalities. People of color, individuals from low-income backgrounds, and those with mental health conditions are more likely to be arrested and incarcerated for drug offenses, despite similar rates of drug use across different demographics. This systemic bias highlights the urgent need for a more just and equitable approach to drug policy, one that prioritizes public health, harm reduction, and social justice. Section 6. Community and compassion, a different path to recovery. In contrast to the harsh realities of Sri Lanka's militarized approach, community-based rehabilitation programs offer a more humane and effective path to recovery. These programs recognize that addiction is not a sign of weakness or a moral failing, but a complex medical condition requiring compassion, support, and a holistic approach to treatment. They emphasize the importance of community, providing a safe and supportive environment where individuals can heal, rebuild their lives, and reconnect with society. Community-based programs often incorporate a range of evidence-based therapies, including individual counseling, group therapy, and family therapy. These therapies address the underlying psychological and emotional issues that contribute to addiction, providing individuals with the tools and skills they need to manage their condition and prevent relapse. They also offer educational workshops on topics such as stress management, relapse prevention, and healthy coping mechanisms, empowering individuals to make positive changes in their lives. One of the key strengths of community-based programs is their focus on reintegration. They recognize that recovery is not a solitary journey, but one that requires the support of others. Many programs offer vocational training, job placement assistance, and other resources to help individuals re-enter the workforce and become productive members of society. They also provide ongoing support and aftercare services to help individuals maintain their sobriety and prevent relapse. By addressing the social determinants of health, such as poverty, unemployment, and lack of access to healthcare, community-based programs create a more supportive environment for recovery. They recognize that addiction is often a symptom of deeper societal issues and work to address these root causes to prevent future generations from falling prey to substance use disorders. Through compassion, community, and a commitment to holistic healing, these programs offer a beacon of hope for individuals struggling with addiction and their families. Section 7. The Salvation Army Model, Faith, Structure, and Support. One notable example of a successful community-based rehabilitation program is the Adult Rehabilitation Center, or ARC, run by the Salvation Army in Seattle. The ARC provides a structured and supportive environment for men and women battling addiction, offering a comprehensive range of services designed to foster long-term recovery. The program is grounded in the principles of faith, structure, and support, providing individuals with a spiritual foundation, a disciplined daily routine, and a strong support network to guide them on their journey to sobriety. Upon entering the ARC, individuals undergo a comprehensive assessment to determine their individual needs and develop a personalized treatment plan. The program incorporates a variety of therapeutic modalities, including individual counseling, group therapy, and work therapy. Work therapy is a central component of the ARC's approach, providing individuals with a sense of purpose, responsibility, and accomplishment. They learn valuable work skills by participating in various tasks within the center, such as cooking, cleaning, and maintenance, preparing them for re-entry into the workforce. The ARC also places a strong emphasis on spiritual growth, offering daily chapel services, Bible studies, and individual pastoral counseling. While the program is rooted in Christian faith, individuals of all faiths and beliefs are welcome and encouraged to explore their own spirituality. The spiritual component provides individuals with a sense of hope, purpose, and connection to something greater than themselves, which can be a powerful force in overcoming addiction. The Salvation Armies RC is a testament to the transformative power of community, compassion, and a holistic approach to addiction treatment. By providing a structured and supportive environment, the program empowers individuals to break free from the chains of addiction, rebuild their lives, and become productive members of society. The ARC's success is a beacon of hope, demonstrating that recovery is possible and that with the right support, individuals can overcome even the most challenging of circumstances. Section 8. Towards a more humane approach. Prioritizing rehabilitation. The stark contrast between Sri Lanka's militarized approach and the success of community-based programs like the Salvation Army's ARC highlights the urgent need for a paradigm shift in how we address drug addiction. Instead of viewing it as a criminal justice issue, we must recognize it as the public health crisis it is. This requires a shift away from punitive measures that prioritize punishment and towards a more humane approach that emphasizes treatment, rehabilitation, and social reintegration. Investing in prevention programs is crucial. By educating young people about the risks of drug use and providing them with the skills and support they need to make healthy choices, we can prevent addiction before it starts. This includes addressing the social determinants of health, such as poverty, inequality, and lack of access to education and employment opportunities, which can increase vulnerability to substance use disorders. Expanding access to evidence-based treatment is essential. This includes increasing the availability of medication-assisted treatment, which has been proven effective in treating opioid use disorder. It also involves investing in a wider range of therapeutic interventions, such as cognitive behavioral therapy, motivational interviewing, and contingency management, which have been shown to be effective in treating various forms of addiction. Finally, we must address the stigma surrounding addiction. This stigma prevents individuals from seeking help and perpetuates a cycle of shame and isolation. By promoting open dialogue, sharing stories of recovery, and challenging misconceptions, we can create a more compassionate and supportive environment where individuals feel empowered to seek help without fear of judgment. Addressing drug addiction requires a collective effort. It is the responsibility of governments, healthcare providers, community organizations, and individuals to work together to create a society where everyone has the opportunity to live a healthy and fulfilling life, free from the grip of addiction. Section 9. Conclusion: winning the war within. The battle against addiction is not fought on a distant battlefield, but within the hearts and minds of those who struggle with this disease. It is a complex and multifaceted issue, one that demands our compassion, understanding, and unwavering support. While there is no one-size-fits-all solution, it is clear that punitive measures such as those employed in Sri Lanka are not the answer. Instead, we must prioritize a public health approach that emphasizes treatment, rehabilitation, and social reintegration. Community-based programs like the Salvation Army's ARC offer a beacon of hope, demonstrating that recovery is possible and that with the right support, individuals can overcome even the most challenging of circumstances. These programs understand that addiction is not a moral failing, but a complex medical condition that requires a compassionate and holistic approach to treatment. By providing a safe and supportive environment, they empower individuals to heal, rebuild their lives, and reconnect with society. The war against addiction is not one that can be won through force or coercion. It requires empathy, understanding, and a commitment to providing those who are struggling with the resources they need to heal. By investing in prevention, expanding access to treatment, and addressing the stigma surrounding addiction, we can create a world where recovery is not the exception but the rule, and where everyone has the opportunity to live a healthy and fulfilling life, free from the chains of addiction. The journey to recovery may be long and arduous, but with each step we take towards compassion and understanding, we move closer to winning the war within.